We're here today with Ray Moore, and Ray has been a patient in the office. How many years do you think, Ray?
A lot.
A lot.
20 plus.
20 plus years, and unfortunately Ray experienced oral cancer. How long ago did this happen, Ray?
Let's see. Year and a half ago.
Year and a half, okay.
Is when the tumor was found.
And the tumor was on the back of your tongue, is that correct?
Yeah, over the hill. So
past the vision orally, so when you look in your mouth you couldn't see anything. Correct. You couldn't see anything, we couldn't see anything.
Right.
So probably an ear, nose, and throat doctor discovered the tumor.
That's
right?
who found the tumor and did the biopsy, yep.
Okay, and fortunately you're here. You have survived your cancer therapy, and you had radiation and chemo, is that correct?
Yeah, now everybody's different. Some
right.
people just have chemo, the drugs. Some people have the radiation where they actually cook the thing through a...
And some people have surgery to boot, like all three.
Some people have surgery.
And what did you have?
Okay, I had the combination of radiation every day of the week, for except every Monday through Friday for 7 weeks straight. I had to go to Johns Hopkins in Baltimore and lay on a table for 35 minutes while they did a radiation thing. And the radiation thing goes around your head while you lay there, and what it actually does is it burns the tumor a little bit at a time each day. It just burns it a little bit. That's why they spread it out over a 7-week period to keep down on the pain of the actual treatment.
Ray, you were a little huskier before this happened. I think you had lost a little weight, didn't you?
Yeah, I was a little husky, all right. I was 252 pounds, wore a 2X shirt and 42 waist. And by the time they finished the radiation, I lost 98 pounds, ended up weighing 152. Went from a 2X to an X to a large, just a large only. Some shirts I can wear medium now. And my waist went from 42 to 34.
So you lost the tumor and 100 pounds.
Right. That's not all good news though, because a third of that is muscle tissue.
Yeah, I understand.
And you really get weak. Really get weak.
What do they attribute, I know they can't be for sure, but what do they attribute the cause of this oral cancer?
Okay. The main culprit that my radiation oncologist doctor was concerned about was the fact that I chewed skull, or some people call it snuff, or
dip, chewing tobacco,
whatever, yeah.
Right. Smokeless tobacco.
Smokeless tobacco, yeah. And it's actually more popular with oral cancers because it stays in a concentrated area.
That's right.
Where if you smoke a cigarette, it'll dissipate through your body. However, it does have to travel through the lungs before it dissipates. And then that's why so many people have lung cancer with cigarettes. But the chew or the chewing tobacco.
And you did this as a young man, you said?
Yeah, I was a young guy in my 20s, and I worked on a construction site. I was a carpenter.
You weren't allowed to smoke, but you could dip, you could chew.
Yeah, you couldn't smoke during work hours because they wanted you working hard. They didn't want you stopping for lighting up cigarettes and that. And so a lot of the guys on the crew, young guys, we started doing the skull to take
ball
the
players do it. A lot of baseball players do it. The athletes with it.
Yeah. And the big kick now is that it's 10 times cheaper than smoking cigarettes.
Wonderful. Okay.
So the economic thing has come in there, where instead of paying $7 for a pack of cigarettes, you can pay $4 for a thing of skull, and that'll last you, depending on how much you
Ray, do you have any advice for young people or people of any age who are considering using smokeless tobacco?
Yeah, I wouldn't recommend you ever use it, and I'm not going to use it anymore.
Listen, buddy, I'm glad you're still with us.
I don't smoke cigarettes anymore. I smoked cigarettes for 42 years.
I'm glad you're still with us. I think you said that some of the people that were receiving treatment with you did not make it.
Correct. I had people there who had the exact same thing, and one man that I know did not make it. I had what they call stage 4, which means this cancer has started to spread now. And it had just begun to spread to my lymph nodes. From there, it would travel through the body, and you're done. But There was another man there who also had class 4, and his had started to spread, but his had spread more already, and it was too late for him. He couldn't make it.
Well, I'm glad you did make it. And we'll tell the young people and people of any age, tobacco, smokeless tobacco, just say no. Thanks, Ray.
Just say no, and even if you get cancer and get through it, you're going to waste a year of your life.
Yeah, okay.
You got a year of your life where you won't have energy, nor time, nor anything else, because you just got to take care of the cancer.
Yeah, I'm glad you took care of it. Thanks, buddy.
Okay.